Why are patients wary of doctors using AI? Survey results explained. Warning: the doctor will see you now with a side of AI. Are you comfortable with the idea of your doctor relying on artificial intelligence AI for your diagnosis, treatment, or even administrative tasks? Apparently, many aren't. A recent survey reveals that the public has significant reservations about the integration of AI in U.S. healthcare, sparking concerns about the future of patient-physician relationships. But here's where it gets interesting. Researchers from the University of Würzburg in Germany conducted a survey to gauge how different AI use cases, diagnostic, therapeutic, and administrative, impact the public's perception of physicians. The study presented 1,276 adult respondents with 4 fictitious advertisements for family doctors, each highlighting a distinct AI application. Respondents then rated the physicians on a 5-point scale for competence, trustworthiness, empathy, and their willingness to schedule an appointment. The verdict: AI-powered physicians fall short in public perception. Across all AI conditions, the surveyed physicians were perceived as less competent, scoring 3.58 to 3.71 points, versus 3.85 for the control group. Less trustworthy, scoring 3.61 to 3.66 points, versus 3.88 for the control group. Less empathic, scoring 3.72 to 3.82 points, versus 4.00 for the control group. Less likely to secure an appointment, scoring 3.15 to 3.15. Study reveals patients trust doctors less when using AI. Look, trusting your doctor could hinge on one surprising detail: whether they use artificial intelligence. And this is the part most people miss. AI isn't just about diagnosing diseases or performing robotic surgeries. Even when used for mundane administrative tasks, its presence can shake the foundation of patient trust. A recent study conducted by psychologists from the University of Würzburg and Charité Berlin reveals a striking trend. Patients tend to view doctors who incorporate AI into their practice as less competent, less empathetic, and less trustworthy. This perception persists even when AI is used solely for behind-the-scenes tasks like scheduling or paperwork. To explore this phenomenon, researchers surveyed 1,276 adults in the United States. Participants were shown promotional materials for various medical practices and asked to assess the doctors featured. The only variable? Some ads included a note that the doctor used AI, either for administrative, diagnostic, or therapeutic purposes, while others made no mention of AI at all. The results were clear. Any reference to AI led to a dip in how patients rated the doctor's professionalism and warmth. But here's where it gets controversial. Why does AI trigger such skepticism? The study's authors, Moritz Reiss and Professor Wilfried Kunde from Würzburg, along with Florian Reiss from Charité Berlin, suggest that patients may fear doctors will rely too heavily on AI, potentially sidelining their own judgment. This concern taps into a broader unease about technology replacing human intuition, especially in fields as personal and sensitive as healthcare. Yet AI is becoming deeply embedded in modern medicine, offering tools that can streamline operations and even improve outcomes. The researchers emphasize that a strong doctor-patient relationship remains essential. Transparency is key. When doctors explain how AI supports their work, especially if it frees up time for more meaningful patient interaction, it could actually enhance trust rather than erode it. AI has the potential to make healthcare more humane, the researchers noted in a statement from Julius Maximilian University. By offloading routine tasks, doctors might gain more time to connect with patients, listen to their concerns, and provide personalized care. So here's the big question. Should doctors openly disclose their use of AI, knowing it might initially unsettle patients? Or should they wait until public perception catches up with the technology's benefits? What do you think? Does AI in medicine make you feel more confident or more cautious? Let's hear your thoughts in the comments.